You're listening to a podcast developed and produced by the Association of Asian Pacific Community Health Organizations, AAPCHO. To learn about AAPCHO, its members, or the principles and values that have guided this organization's work for more than 20 years, please visit www.aapcho.org. Building Sustainable Healthcare Homes is a new podcast series showcasing AAPCHO's Cultivating Traditions of Wellness 2010 Conference and Gala on February 23, 2010 in Washington, D.C.
In this additional track, Emmanuel Kintu, AAPCHO Board Vice President and CEO of Kalihi-Palama Health Center, provides inspirational closing remarks to conference attendees.
The future is bright. Patient-centered healthcare homes, community health center version. What is really going to make us different? Are we really prepared to implement something that is going to deliver the value that we are promising? Will we do it consistently? Will each community health center be able to deliver on this promise? Are we strong enough to make sure that each and every one of us, including the weakest, is able to deliver on that promise? So as we go out pounding the pavement to get others to enable us to accomplish this goal that we're setting for ourselves, let's remind ourselves that we have to work within the family, within this home, to make sure that we are enabling each other such that the weakest amongst us is going to be able to deliver on this promise. And again, the future is bright. The future is bright, and I think I can conclude with this. The difference that we as patient-centered healthcare homes that are community health center focused bring is an effort to maximize the value for individuals and families. Providers or physicians, hospitals, if you just group them like that, would start emphasizing something different. The sicker you are, the more you doctor you've heard that before. Or if it's the insurance companies, and I know we do have some really excellent insurance companies in here, so I'm not referring to these, we'll probably try to minimize cost. But we, the patients, the consumers, will try to maximize value for the community. We will reward the seeking and the delivery of appropriate healthcare. We will reward things that yield better results regardless of when that happens. We will not say we'll not fund primary care today, we'd rather pay for the hospitalization. We can comfortably reimburse our providers and the teams that surround them if we are really serious about delivering value with these patient-centered healthcare homes. If we believe that we can reach out to the community, we can reach out to the nation, we can reach out to other entities and provide them with some of the education and some of the learning that we are seeing from what we are doing, the good research that AAPCHO is doing. What makes it difficult for Community Health Center A to work with Community Health Center B to deliver excellent care? What makes it difficult for us to unite as community health centers in each of our communities to work on things that would enable us to leverage the resources that we have in our communities? They shouldn't be anything. I think today we've received an extra injection of the good kind of virus, the one that enables you to do good things. And I think we're going to go out and do good things for our communities by demonstrating that we can really deliver value as patient-centered healthcare homes, CHC style. The future is bright. Thank you.
This podcast was brought to you by AAPCHO. Please join the conversation on our Facebook fan page at facebook.apcho.org and tune in for our next podcast at www.aapcho.org.